Today is April 2nd, and we have recently learned that the shelter-at-home order will be extended through April 30th. While many of you are at home, there are also many people who come to this hospital every day. Nurses, doctors, respiratory therapists, pharmacists, phlebotomists, imaging techs, environmental services team, building services, nutrition services, and the list goes on. Basically, everyone who contributes to making Silver Cross operational and safe are not staying at home and showing up. But today, I'd like to talk about the first responders, the people who are first on the scene, the people who we depend on, whether it's a COVID-19 crisis or any other illness. These are the folks that work round the clock saving lives. So with me today is Dr. David Mikolajczak, or as we call him, Dr. Dave, Medical Director of Silver Cross Emergency Medical Services, which covers Will and Grundy counties, and Bill Kallal, Manager of EMS and Emergency Operations. Thank you both for being here. So, Dr. Dave, let's start with you. Can you give an overview of what's happening in the community?
Certainly, Ruth. Thank you. Our paramedics, our EMTs, first responders, they're really the heroes out there. They're providing the services every day. And we've seen kind of a decrease in our call volume over the last several weeks. However, the patients are sicker. We certainly are requiring our medics to be wearing appropriate PPE with goggles and gowns and masks and protecting themselves, but they are still continuing to respond to all the calls in our community and providing those critically needed services.
Thank you. And so, Bill, how many calls are you getting a day now?
Like Dr. Dave said, the call volume is down in general. Our ambulance through the doors per day used to be about 60 visits. We're down to about 25 right now. But again, the acuity of the patient is much higher than it has been. Overall, system-wide, and again, those are statistics are just for Silver Cross. I'm not sure exactly what the intake in the other hospitals is, but just talking to the other coordinators in the region, overall call volume is down, but acuity is much higher.
So people are sick.
They're sicker.
Home.
They're definitely sicker.
Dr. Dave mentioned protective equipment. Do you feel you have enough supplies?
Well, that's always it's really dependent on the nature of the call. Most of our providers are well stocked, but for the long haul, they're going to need some support. So we try to provide that to them the best we can.
Thanks, Bill. And of course, the hospital is happy to support as well. Thank you. So, Dr. Dave, how many first responders are part of Silver Cross EMS?
We have about 2,000 paramedics and EMTs in our system that are providing care throughout the region, from the Indiana state line all the way to Morris, from up near Lamont, south to Wilmington. So we are well supplied with first responders who give fantastic care.
Absolutely. And Bill, how do all these people get trained?
A lot of them kind of run through our doors here. We have our own education program set up for both paramedic and EMT level training. We put about 30 to 35 per class, and we do 2 classes per year through the paramedic program, and then another about 20 or so through the EMT programs throughout the year. So we're one of the more robust programs in our area, and so we put about 100 providers back out into the communities every year.
That's fantastic. Thank you for sharing that with us. How would you say the overall morale is right now?
I think given the severity of the situation, our paramedics, pre-hospital providers are very resilient, and they're handling this better than I expected. There are certain pockets of anxiety and concern, as you might expect, but overall, they're continuing to do a fantastic job in handling this situation very well.
Yeah, I can only imagine that their friends and their family members must be really concerned as well.
There's quite a bit of anxiety in the providers as well as in the community and their families.
Yeah. Bill, what are you most worried about right now?
The biggest worry that I have is maintaining protection levels for the providers out there. Certainly you want to reduce the risk of exposure to them because they're on the front lines, and without adequate staffing in the communities, that can lead to poor outcomes for people if we don't have the providers to help them.
Right. Are we seeing many first responders become infected with COVID-19?
We have had several who have turned positive after exposures in the pre-hospital setting. So that does pose some staffing issues for the given departments when they need to take a provider off the line and quarantine them for some time, as well as their colleagues who might have been on that call.
Right. So we have to trace back who's been
Correct.
exposed.
Yes.
Exactly. Just like we do here at the hospital.
That's right.
Right.
Yes.
So, Bill, any requests for the community that you would like to make right now?
Yes, please follow the shelter-in-place order. That is the biggest thing you can do to not only protect yourselves, but also the first responders and any other stakeholders in the community. It's the most important thing. And wash your hands.
Wash your hands.
Definitely wash your hands.
Thank you.
Sure.
And 6 feet.
6 feet.
6 feet.
Yes.
Correct.
Thank you.
Yeah.
Thank you both very much. And thank you for your service. And please extend our wholehearted gratitude to everybody in the EMS system.
Well,
Thank you.
Ruth.
Thanks,
Thank you.
Ruth. We appreciate it.
Yes.
Thank you.